Hi everyone, I welcome you all to this FB Live by Apollo CBCC Cancer Care. I hope all of you are doing well. So today our topic of discussion is breast lumps. So when it comes to breast lumps, a lot of question arises. What are they and are they dangerous or do they indicate cancer? So questions like these arise in our minds. So to answer all these questions, we have an expert, a renowned one with us, Dr. Anagha Zope. So let me welcome Dr. Anagha Zope. We are glad to have
Namaste.
you. Yeah.
Namaste. Thank you for inviting me.
So, about Dr. Anagha Zope. Dr. Anagha Zope is a senior consultant breast oncoplastic surgery at Apollo CBCC Cancer Care. With over 25 years of exemplary surgical experience in the field, Dr. Zope has pioneered the establishment of multidisciplinary breast cancer management and oncoplastic breast surgery at Apollo CBCC Cancer Care and Apollo Hospitals International Limited. So, ma'am, we are really glad to have you.
I'm really happy talking to you and our esteemed audience today.
Yeah, it's pleasure. Same here, ma'am. So, ma'am, any welcoming remarks you would like to throw to the audience?
So the in my welcoming remarks, I want to welcome this concept of making oneself aware about breast cancer and symptoms of the breast, and let's get the power to defeat this disease by our efforts.
Okay. Yeah. So, thank you so much, ma'am. Can we start with the questions?
Yes, please.
Yeah. So, my first question to you is, what are breast lumps? Is lump in breast normal?
So lump is any solid mass that anybody feels in any part of the body. And similarly, lump in the breast is any solid area or a solid mass that someone feels or notices in his or her own breast. Every lump in the breast is not a concern, and every lump in the breast does not signify that it is a cancer. However, because there is always a probability that this might be a cancer, one should be aware about it. One must look for them and should get them checked by a specialist once there is such a suspicion.
So, ma'am, are all breast lumps that women may or may not have, are they cancerous?
Not at all. In fact, you would be surprised to know that when I sit in my outpatients and see 100 women who come to me with a complaint of breast lumps, probably just 12 to 15% of them, so only 12 or 15 out of every 100 women with breast lumps, would be diagnosed with a cancer or a cancer-like tumor. Most of the other lumps are non-cancerous and do not fall into that category.
Okay, ma'am. So, ma'am, if the lump is cancerous, so how do we figure out is it a breast cancer? So,
There are certain symptoms and signs which are associated with a lump that is more likely to be cancerous. The first and foremost being it is a painless lump and it is continuously growing in size. It is not very freely movable inside your breast, and it has it's absolutely symptomless as far as any other pain related issues are concerned. It may or may not be associated with certain signs and symptoms in the nipple, like the nipple being drawn inside, like there being bloody discharge from the nipple. It may or may not be associated with certain swellings in the underarms, which are related to the lymph nodes. So these are signs which should make one a little more critical about it being cancerous. But the best way to know whether it is cancerous or not is to get it checked by a specialist.
yeah, true, ma'am. Ma'am, which I have heard, there have been speculations that only women can get breast cancer. So, is it so?
Not at all. Women do get breast cancer with a more higher frequency than men. For every 100 to 120 women with breast cancer that I see, I would see a male patient with breast cancer. But breast cancer does affect men, and it is a very, it's not one of the rarest of rare thing to happen for a male patient.
Okay. So, even men can get breast cancer.
Very much.
Yeah. Okay, ma'am. So if somebody gets it, so what are the chances of curable? Matlab, how curable it is?
Breast cancer is one of the most well cured and well treated cancer in the world today. We have got a very good synchronized treatment facility available for breast cancer treatment across the world and in our country and our city as well. Breast cancer is treated by a tailor made therapy for every patient using what is called as multidisciplinary treatment plan. So, where multiple oncology specialists would come together and plan the treatment as per your breast cancer norms for every patient individually. One of the best treated cancers in this world.
Mhm. Nice. Okay, ma'am. So, are there any types also of breast
Yes.
cancer?
Breast cancer has many subtypes, and breast cancer is one of the cancers today which is identified to have different molecular subtypes, and every molecular subtype has a different perspective about its occurrence, its prevalence, in which type of women it is seen more, and what is the prognostication, not just prognostication, but also what treatment is going to be given to a particular breast cancer patient depends upon which is a type of breast cancer that women have. Predominantly, these classifications center around two very important tests which are done in breast cancer patients, which are called as hormone receptors and HER2 new oncogene identity. So, based on the permutation combination of these two, or rather, there are three markers, the breast cancer will be classified into one of its many subtypes.
Okay. So, ma'am, are there any risk factors also that makes you more prone to get breast cancer?
Breast cancer is a multifactorial cancer, which means that more than one factor usually would be playing its role in a person getting breast cancer. Most of the factors are, can be very easily divided into factors which are not controllable. So, if they are there present in your case, they are going to increase your risk of getting breast cancer. And there are certain factors which are externally acquired, or which are factors which can be controlled. If these risks factors you can reduce in yourself, you can overall reduce your risk of getting personalized risk of getting breast cancer. The most important factor is whether you have a family history of breast cancer, ovarian cancer, or prostate cancer in your family, whether you have had any past history of a suspicious breast biopsy. With increasing age for a woman, the risk of breast cancer always increases. And like you rightly discussed earlier, women are at a higher risk of getting breast cancer, much more higher risk than men. Besides this, those women who start their periods very early and continue to get their periods for a very older age, above 50 or 55, are at a higher risk of getting breast cancer. There are some factors like obesity, especially obesity around your menopause, the unhealthy lifestyles like eating a lot of food which is rich in or what we call as junk food, which would lead you towards obesity. Women who take hormone replacement therapy, women who never have had a pregnancy or have delayed their first pregnancy, and women who do not breastfeed, they are at a higher risk of getting breast cancer.
Okay. So, avoiding these risks may reduce your chances of getting breast cancer.
Definitely, controlling these risks will reduce your own risk of getting breast cancer.
Okay. So, doctor, I'm done with my set of questions. Let's see what our viewers have to ask.
Mhm.
Yeah. So, first question we have is from Samuel John. He's asking, surprising to know about men getting breast cancer. So, he's surprised that men can also get breast cancer.
Definitely, definitely. And I think it is a very important thing for men to understand that, especially those men who belong to families where women have had breast cancers in the past, or there has also been history of, along with breast cancer, the incidence of ovarian or prostate cancer in the family, especially those men need to be aware that they are at a higher risk. And in those families where identified BRCA mutation has been found in women with or without breast cancer, those men also need to get tested for BRCA mutation.
True, ma. True. Next we have is Pragya Khanna. She is asking when or at what age should one get screened for breast cancer?
So, Pragya, this is a wonderful question. What does one mean by getting screened for breast cancer? That means that when you have no symptom at all, you have no complaints related to the breast, yet you want to know what is your risk of having or getting breast cancer in the future. So, today is the best day to get screened for breast cancer, I would say. It's
Hmm.
just that we associate breast cancer screening with mammography based screening, and mammography based screening is advocated after the age of 40 in our country. Before that, also, women should get themselves screened for breast cancer by self breast examination. So, you evaluate yourself, and by going for annual clinical examinations with your doctor or your GP, your gynecologist, or your surgeon. We recommend that after the age of 30, women should get their breast checked clinically with their doctors, and after the age of 40, they should enroll for mammography based screening programs.
Okay. Next, we have is Hiral Shah's question. She is asking, can breast cancer be prevented?
So, Hiral, unfortunately, in the theoretical terms, breast cancer cannot be prevented as of today. We do not have any modalities, any vaccines, any injections, or even surgeries where we can say that we have 100% been able to prevent breast cancer. But yes, there are ways in which you can take lifestyle measures and reduce your own personal risk of getting breast cancer to an extent where the risk of getting breast cancer practically becomes null.
Next, Dhruv Rajput, he is asking, breast cancer treatment affects women's ability to have a baby?
Dhruv, this is an excellent question and a very aware question. Yes, breast cancer treatment, especially where breast cancer treatment involves chemotherapy and hormonal therapy, can very much affect a woman's ability to have a baby. It is every woman's right to ask her treating team for fertility preservation, and you should do that before you initiate any treatment for breast cancer. We can preserve fertility for women undergoing treatment for breast cancer, and I have had patients who have gone ahead and completed their complete therapy for breast cancer and went ahead and had normal pregnancies with normal babies.
Nice. Next, Anmol Saparia, she's asking, are there any specific symptoms for breast cancer except for breast lumps?
Very much. Uh, Most importantly, we need to understand that there may be no symptoms at all for breast cancer. And that is why you have to examine your breast to look out for them. These symptoms are usually pain free, and that is why we miss them. So, you have to start looking out for them. Besides a breast lump, the most pathognomic or the most significant symptoms for breast cancer are retraction of your nipple, that's the inward turning of your nipple, any ulceration or bleeding from the nipple, blood-stained nipple discharge, any areas of your breast skin which are getting dimpled inside or which are getting tethered inside, and any swelling in your underarm lymph node areas, all of these can indicate a probable breast cancer.
Okay. Uh, Jackson Dami is asking, I have a question for my son. What can be done to lower the risk of breast cancer?
Um, I'm not able to understand. Is it a question for your son or what? But any person, if they want to reduce, any person who wants to reduce his or her own risk of getting breast cancer, needs to understand that we cannot reduce our controllable, uncontrollable factors, that you are a woman, that you are aging, that you have family history of breast cancer, that you were unfortunately unable to conceive or breastfeed your child. These are some things you can't change. But what can you change is your lifestyle. Having a healthy lifestyle, having a regular sleep pattern, eating diet which is rich in fresh fruits and vegetables, reducing or avoiding consumption of red meat and alcohol, eating food which is low in refined flour and refined oil, exercising regularly, and maintaining your weight, especially around the age of menopause, is one way one can definitely reduce or lower your own risk of getting breast cancer.
Okay. So I think, ma'am, we are done with the viewers' questions too. So thank you so much. I would like to thank you for delivering such an interactive, insightful session, and we are so glad to have you. Thank you for joining us.
Thank you, Sonam. Pleasure is mine. Thank
Yeah.
you.
So viewers, thank you for joining. And if you ever need a cancer consultation, you can definitely visit Dr. Anagha at Apollo CBCC Cancer Care, Ahmedabad. So thank you so much for joining. Thank you so much, doctor.
Thank you.
Thank you. Bye.
Bye.